Hi, this is Jessica DaMassa with WTF Health. I'm here with Santosh Mohan. He is the head of the More Disruption Please Labs, plural, at Athenahealth, because there's more than one. So I hear that you guys did a big hackathon over this weekend here at Health, focusing on physician burnout. Why are you guys choosing to, direct these startup efforts toward this particular issue?
Yeah, well, because it's a big epidemic, and overworked and run down and exhausted and depressed are not the words that we should be using to describe our doctors, but that is the unfortunate situation that we are in today.
Right.
More than half of the doctors are burnt out. I mean, you just have to flip the coin to find out if your doctor is burnt out. We really want to go after that problem because time and again when we speak with physicians about burnout, they point to clerical responsibilities and documentation as the number one cause. Because for every session, they have to tick every box and tie every order and respond to every request for payment and authorization. And then navigate patients through a complex maze of what we've become as an industry. And then at the end of the day, lose sleep thinking about if the patients even got through all that friction to get what they want. And so this past weekend, we came here and we said, is your code good enough to bust the barriers that keep physicians from doing what they do best, which is caring for patients? Sure. Can you heal our healers? Can you care for our caregivers? Can you help them be less bogged down and more freed up so that they can be present in the moment of care? And we had a great time doing this. We had nearly 25 teams that worked on the challenge.
Yeah.
And we were doing this alongside HHS, CTO office, and a number of other technology providers. And we've seen a range of great
I was going to say, so tell me I'm going to ask you a couple of different questions. Yeah. So tell me like the weirdest thing that you saw come out of this. Like what was the thing where you were like, oh, okay. Like what was the weirdest thing that came out?
Yeah, I wouldn't say it's the weirdest thing, but it's something that I didn't imagine someone would come up with.
Okay.
So we also had Fitbit as part of the challenge, right?
Okay.
Health had Fitbit there. And so someone came up with this idea of, we want to use Fitbit to sort of think about, tracking physician sleep deprivation and their activity throughout the day. And we were like, we already know that physicians are burnt out, but they came up and said, no, it's not to tell you about whether they're burnt out or not, but we want you to use that information to really help the practice optimize the schedules for these physicians to see who is burnt out, what the level of this burnout is, and then manage those schedules in a way by lending them more support or giving them more resources and tools or latitude, like Jonathan discussed in the talk yesterday. So I thought it was a really great way of like mashing up a consumer technology with really what we are going after, which is the health and
cool.
the happiness.
All right, what was the one that you were most excited about?
Yeah, so we picked a team called Iris, which was a great innovative application that came out of the hackathon. We're super happy because we did reward them with gifts and gadgets and all of that stuff. But really, what we want to do with them is provide them co-working space in our Watertown office and provide them access to our platform. And provide them the resources to really nurture their idea to the market.
What was their idea?
And the idea...
Oh my God, the suspense.
Yes, you have to build it up.
Oh my God,
So the idea was really about, it was a smart digital assistant that would passively capture all the important information from a doctor-patient conversation and tee up all the orders and the medications or pull up the right kind of results that the encounter requires in a very passive way, without the doctor needing to get away at a number of different screens and go through that click or stare away from the patient. So it was really great that they were able to build this out and seamlessly integrate with the Athenahealth workflows and demonstrate it, which to us was gold. I mean, it was just over a weekend.
Okay, we're awarding you office space.
Yeah, so we're looking forward to them coming and working with us.
Cool.
It's just two guys, one of them from Brooklyn, New York, and one of them from Amsterdam.
Very cool.
So happy.
All right. So we've been asking everybody, and I want your input on this. We've been asking everybody about WTF Health. So like, what's the future?
Yep.
What's the future in this space? So I want to know. You're somebody who works with startups all the time, and I feel like the climate's starting to change. I mean,
Yeah.
the Affordable Care Act, like changing the way that things are being reimbursed and what the priorities are from like, an organizational standpoint. So what are you seeing? Like, what's the future as far as startups are concerned?
What's
are you?
the future?
What's the future? What are you seeing?
Yeah.
Startups that are disappearing, startups that are appearing now. All of a sudden, they're blockchain startups. What are you
Right.
seeing in your space?
Well, let me say this. There's no dearth of shiny things in our universe, right? There's always going to be shiny things. There will be, they have been, and that will continue. But really, what we are seeing and what we are heartened by and what we want to have more of, more disruption, please, is the kind of solutions that really sort of, to our earlier discussion, take away those intrusions from caregiving.
Okay.
And we're seeing more of those companies come up, step up and think about, how do we remove the friction from the workflows? How do we make it easier for the physicians to, spend more time with the patients? And these are not moonshots that kind of will blow your hair back, but this is important work that will change the life of the doctors, keep them, give them the resources that they need, and ultimately keep us healthy.
Yeah.
Because a healthy nation really depends on healthy doctors. So we're very excited about a lot of bright spots that we are seeing and that we are bringing onto our marketplace. More Disruption, Please is really a program that believes in making healthcare work as it should.
Yeah.
I mean, and that is the passion that fuels who we are. It's really our way to engage with entrepreneurs and companies and investors and innovators and anyone that shares the same passion as us about changing the status quo or challenging the status quo through openness and connectivity of disruptive solutions. And those are the ones that we care the most about. And, it's great to be working with them.
Fantastic. Santosh, we've been hearing a lot about this. This is a hot tip here. More of these enterprise-wide innovations and more of the things that help make the system work better. So yeah, we've definitely been hearing that a lot. Thank you so much for joining us. It's a pleasure to talk to you as always. I'm Jessica DaMassa with WTF Health.